Imagine a scenario, right, where every single piece of biological evidence is just gone. Like a mass fatality event, um, a plane crash, or a fire so intense that all the DNA is just entirely degraded.
Yeah, which is a really grim thought, but it happens. Fingerprints are destroyed. Medical records that rely on physical characteristics are completely useless.
Exactly. So how do forensic investigators return a name to a victim? Well, they have to look for the only structures left in the human body that are actually capable of surviving that kind of extreme trauma. They look at the teeth.
Because enamel is, the hardest, most mineralized substance we possess.
Right. But it isn't just that the teeth survive. It's that the three-dimensional geometry hidden inside the roots of those teeth is literally as unique as a fingerprint.
Which is just an incredible reality to wrap your head around. I mean, the exact same microscopic curves and hollow pulp chambers that a local dentist navigates to safely perform just a routine Tuesday afternoon root canal. Those are the exact same resilient markers a forensic odontologist relies on when all other identification methods fail.
And to understand how we get from a routine dental visit to, solving forensic mysteries, we have to start at the absolute foundation. If you were setting out to write the next great American novel, you wouldn't just sit down at a keyboard and start mashing letters hoping a story magically appears.
No, of course not. You have to learn the alphabet first.
You have to understand how those letters form words, how words form sentences, and how those sentences build an entire world. Welcome to today's deep dive. Whether you are a medical or dental student staring down your first year of clinicals, a young healthcare professional brushing up on the fundamentals, or just an insanely curious learner who wants to understand the hidden architecture of the human body, we are learning the alphabet of the human mouth today.
You really cannot practice dentistry or even fully comprehend things like human digestion and skeletal anatomy without mastering these physiological letters first. It is the absolute prerequisite.
Our source material today is essentially the ultimate dictionary for those letters. We are diving into Wheeler's Dental Anatomy, Physiology, and Occlusion, 10th edition, authored by Dr. Stanley J. Nelson. The mission here is to provide a comprehensive, highly educational summary of this foundational medical text for you.
Yeah, we're going to unpack how the fundamental form of teeth serves as the ultimate blueprint for literally every single phase of dental practice.
Right, translating this incredibly dense anatomical data into real-world clinical and forensic applications.
And it's worth noting the legacy of this source text, too. It has been a cornerstone of dental education for generations. If you look back at the early editions, they actually included contributions from pioneers like Dr. G.V. Black, who is, widely considered one of the founders of modern dentistry in the United States.
The current textbook actually pays homage to the very first edition's preface, which was written by Dr. Wheeler himself. He wrote, and I'm quoting here, "No successful practitioner fails to recognize the importance of the fundamental form of the teeth, their alignment and their occlusion, as a basic subject serving as a background for all phases of dental practice."
That statement holds up perfectly today. I mean, it's timeless. But what is really interesting is observing how the delivery of this information has modernized.
How so?
Well, the biological anatomy hasn't changed, obviously, but the pedagogy has. This 10th edition now integrates digital evolved student resources, things like virtual reality, 3D tooth ID quizzes, digital animations, interactive flashcards. It is this wild collision of 19th century observational science and 21st century digital learning.
Let's start building this map then. Because before we can talk about how a clinician fixes a broken tooth or how that tooth functions during digestion, we really have to establish a scientific language.
Right, we need the geographical coordinates.
Exactly. When you are looking at a tooth, you aren't just looking at a flat white square. You are looking at a highly complex three-dimensional structure.
And that structure requires incredibly precise nomenclature. The text details the mammalian tooth formulas, which is basically a way of biologically categorizing teeth.
Like how humans have specific types of teeth for specific jobs,
Oh,
right?
yeah, exactly. Humans have incisors for cutting, canines for tearing, and then premolars and molars for grinding. But to actually treat a patient, a clinician needs to communicate exact locations on those specific teeth.
Right. And the textbook introduces this system of dividing teeth into thirds, mapping out what are called line angles and point angles. So for someone listening and trying to visualize this, imagine taking a single tooth and placing it inside a tight, invisible box.
Okay, I can picture that.
You slice that box horizontally into a cervical third, so that's the portion nearest the gum line, a middle third, and an incisal or occlusal third, which is the top biting edge.
And then you slice it vertically, right? Which creates this three-dimensional grid. A line angle is formed by the junction of two surfaces of a tooth crown. So, picture the corner of a room where two walls meet.
Oh, I see.
And a point angle is where three surfaces meet, like the very corner of the ceiling.
Okay, I mean, I understand the geometry, but I want to push back a little on the necessity of it because it sounds a bit like academic busywork. Why does a practitioner actually need to memorize the name of a microscopic point angle?
It sounds tedious, I know, but without that universal coordinate system, the entire restorative process falls apart.
Really? How?
Let's say a dentist is preparing a tooth for a complex ceramic crown. They cannot just guess where a curve begins or ends. They have to communicate with the dental laboratory technician who is physically fabricating that crown, usually miles away.
Ah, so they need a shared language.
Exactly. If the dentist notes a defect or a specific anatomical requirement at the, say, mesiobuccal line angle, mesio meaning toward the midline of the face, buccal meaning the side facing the cheek. The lab technician knows the exact millimeter of space they are referencing. It allows for absolute pinpoint accuracy in clinical documentation and fabrication.
Okay, that makes total sense. That clarifies the geography. But, teeth don't just magically appear in those positions. They follow a very strict developmental timeline.
They absolutely do.
The text dives heavily into the development and eruption chronologies of teeth, starting with our very first set. And there is actually a semantic debate in the medical community about what to call them. Some call them primary teeth, others call them deciduous teeth.
Right. Deciduous meaning they shed, much like a deciduous tree sheds its leaves in the autumn.
Exactly. And the textbook points out that professionals need to be comfortable with both terms, primary and deciduous, because they are used pretty interchangeably across scientific literature.
Yeah, but honestly, the terminology is secondary to the actual timeline. Understanding the precise chronology of how these teeth calcify and erupt has massive clinical implications.
See, I can see why an orthodontist might care about eruption timelines, to plan for braces. But why does a general practitioner or a pediatrician need to memorize the exact month a lower central incisor begins to calcify in the jaw?
Because dental age is actually one of our most profound indicators of overall physiological development. A tooth doesn't just, pop through the gums fully formed.
Might take time.
It develops in a bony crypt inside the jaw for years prior. So if a clinician takes an x-ray and notices that a child's dental development is significantly delayed compared to their chronological age, that acts as a vital diagnostic clue.
Wow, so it can point to larger issues.
Exactly. It can point to underlying systemic diseases, endocrine disorders like hyperthyroidism, or even the effects of severe environmental risks.
It's essentially a biological clock ticking away inside the bone, acting as an early warning system.
It is. And from a purely surgical standpoint, knowing these chronologies is really just a matter of doing no harm.
What do you mean?
Well, if a pediatric oral surgeon has to remove a pathology or a supernumerary, which is an extra tooth from a child's jaw, they have to navigate through that bone. They need to know exactly where the unerupted, developing permanent teeth are hiding.
Oh, so they don't accidentally damage them?
Right, so they don't inadvertently sever the blood supply to a permanent tooth that isn't even scheduled to erupt for another 5 years.
That spatial awareness is so crucial. But speaking of spatial awareness, I hit a section early in the source material that genuinely confused me.
Oh yeah? Which part?
The section detailing physical tooth drawing and carving. Because we just established that this 10th edition comes with virtual reality 3D quizzes, digital animations, and all this incredibly modern tech.
True.
With haptic feedback simulators existing today, why on earth does this textbook still insist on students physically carving teeth out of blocks of wax with hand instruments? Why not just swipe on a tablet or use a VR headset?
It's a really common critique from new students, actually. But you have to remember that dentistry is fundamentally a microsurgical discipline. It requires a level of profound manual dexterity and proprioception that digital screens simply cannot replicate yet.
But surely a VR simulator with haptic feedback can replicate the feeling of cutting into a tooth.
Haptics are improving, definitely, but they do not yet perfectly mimic the distinct tactile resistance of different biological tissues. When you carve a tooth out of wax, you are literally establishing the neuromuscular groundwork for your entire career.
That's intense.
It is. You are learning exactly how much pressure to apply with a sharp blade. You are feeling the resistance of the material as you try to recreate the subtle convexity of a buccal surface, that cheek-facing side we mentioned earlier, or the sharp, plunging depth of a developmental groove, which is the natural valley on the biting surface of a molar.
So you're essentially teaching your hands to see the anatomy, not just your eyes.
Exactly. By the time that student is eventually holding a high-speed drill, operating at 400,000 RPMs in a patient's mouth, working in a space the size of a teacup while looking backward through a tiny mirror, their hands already intuitively understand the fundamental curves and angles they need to protect or recreate.
That bridge between the visual map and the tactile reality is fascinating, and it naturally transitions us into the biomechanics of the mouth. Because once your hands know the shape of the tooth, you have to understand why the tooth have that specific shape in the first place.
Right. Form follows function.
Exactly. In the biological world, structure dictates function, which in turn dictates how a clinician must approach treatment.
This brings us to the physiological form of the teeth and the surrounding periodontium.
Hold on, let's pause at periodontium.
Mm.
Let's translate that for the listeners who aren't in dental school.
Fair enough. So the periodontium refers to the supporting structures of the teeth. It includes the gums, the periodontal ligament that acts as a sort of shock absorber, and the alveolar bone that houses the roots.
And the health of that entire supporting system relies heavily on the structural curves of the teeth themselves, right?
It absolutely does.
The text mentions a few very specific anatomical features here. Proximal contact areas, interproximal spaces, and the height of the epithelial attachment at the cemento-enamel junction.
That is a mouthful of terms.
Let's break those down because they sound incredibly dense, but the physical mechanism is actually quite intuitive once you picture it.
Let's start with proximal contact areas. These are the specific spots where the side of one tooth touches the side of the adjacent tooth. And it isn't a broad, flat surface rubbing together. It's a rounded, highly specific contact point.
And the space just below that contact point where your gums actually sit is the interproximal space.
Right. And that tiny contact point serves a massive biological function. It acts as a shield. It deflects food away from the delicate gum tissue directly beneath it during the immense pressures of chewing.
You know, I was reading this section on embrasures, which the text also refers to as spillways, and I immediately thought of architectural gutters on a house.
Oh, I like that. Walk us through that analogy.
Well, when a house is built, the roof is pitched at a very specific angle, right? When it rains, that angle catches the water and directs it down into the gutters, rotting it safely away from the foundation. So the foundation stays dry and stable.
Yeah, that makes sense.
In the mouth, when you bite into something hard, like an almond, the curved surfaces of the teeth act like that pitched roof. They direct the crushed food through these spillways, the embrasures, so the food slides safely over the gums, providing just enough friction to gently stimulate the tissue rather than violently packing down into the bone.
That is the perfect visualization. Now, take it a step further. What happens to the house if the gutters are blocked?
Oh, the water just pours directly down the side of the walls, pools at the base, and eventually rots the foundation.
That is precisely what happens in the human mouth if a clinician ignores these fundamental curvatures. If a dentist is placing a filling or a crown and they make the anatomy too flat or, too bulky, they are essentially blocking the gutters. The natural spillway is just gone.
So the crushed food really has nowhere to go but straight down.
It packs violently between the teeth. The patient can't clean it out. The gums become chronically inflamed, bleeding constantly. And that inflammation signals the underlying bone to retreat, causing localized periodontal disease.
Wow, so the whole biological system backs up and fails.
All because the clinician failed to respect a single millimeter of anatomical curvature.
Form dictates function.
Yeah.
And bad form dictates failure.
Always. This reality dictates literally everything a clinician does. It even dictates the manufacturing of dental instruments. For example, periodontal scalers. Those are the instruments used to clean calculus and tartar from below the gum line. They are manufactured with highly specific blade angles.
Wait, to match the roots?
Specifically to adapt seamlessly to the cemento-enamel junction, or the CEJ.
Which is what exactly?
That is the exact anatomical line where the hard enamel crown of the tooth meets the root surface, which is covered in a softer tissue called cementum. The gum tissue attaches firmly to the tooth right at this junction.
So it's a very delicate area.
Exactly. If an instrument isn't designed to naturally hug that fundamental curvature, the clinician risks severing that delicate epithelial attachment while they're just trying to clean the tooth.
Which would cause the exact gum recession they were trying to prevent in the first place?
Right. It defeats the whole purpose.
The textbook also makes a really fascinating point about aesthetic dentistry in this context. Because, we tend to think of cosmetic dentistry as just picking the brightest shade of white possible. But the text makes it incredibly clear that success in aesthetics isn't just about color.
Not at all. I mean, you can give someone the brightest, whitest porcelain veneers ever manufactured, but if the shape, the form, the functional bite pressure, and those embrasures are wrong, the case is a clinical failure.
Just because the forces of the human jaw are too strong?
Yeah, the masseter muscles in the jaw can exert incredible force. If the structural anatomy of those veneers doesn't respect the fundamental biomechanics we just discussed, one of two things will happen.
Which are dip?
Either the unnatural angles will cause the porcelain to just chip and shatter under the occlusal forces, the biting forces, or the bulky, improper contours will cause the patient's gums to become chronically infected and swollen, ruining the aesthetic result anyway.
So delivering artistic functional anatomy isn't just the icing on the cake, it is the entire foundation of the profession. Aesthetics is simply the natural byproduct of healthy, structurally sound anatomy.
Yes. Build the architecture correctly, and it inherently looks beautiful. That is the ultimate takeaway of clinical practice.
Okay, so we have covered how this textbook anatomy guides clinical healing, instrument design, and restorative aesthetics. But we promised you, the listener, a look at the darker, more unexpected applications of this knowledge.
We did.
Because the blueprint of a tooth extends far beyond the dental chair. We need to look at comparative anatomy and forensics.
Forensic odontology is actually one of the most profound applications of dental anatomy. It utilizes the exact same anatomical map, but for a completely different end goal.
The source material highlights several specific applications here. Forensics uses dental markers for age determination from human skeletal remains. They use the analysis of bite marks as biological evidence in criminal investigations, matching the unique wear patterns and rotations of a suspect's teeth to injuries on a victim.
Right.
But the most crucial role is in mass fatality incidents. The textbook's bibliography explicitly references a Department of Justice report detailing the DNA identification lessons learned from the 9/11 mass fatalities.
It is a sobering reality, but scientifically it is an absolute necessity. To understand how they do this, we really have to look inside the tooth itself, specifically the complex anatomy of the pulp chambers and the root canals.
That's the hollow space inside the tooth where the nerve and blood supply live, right?
Correct. As a tooth develops and as it ages, it lays down secondary layers of tooth structure internally, which naturally changes the shape of that hollow chamber over time. Furthermore, every root has a highly specific, intricate geometry. Well, some roots curve sharply at the very tip. Some roots have 2 microscopic canals instead of just 1.
Which brings us back to your earlier point about the endodontist, the root canal specialist.
Right. The clinician studies these intricate internal geometries so they can safely navigate that tiny, dark space, clean out an infection, and seal it up to save the tooth. And to do that, they take detailed, high-resolution x-rays of those roots.
And those x-rays become the antemortem records the before-death map.
Exactly. Fast forward to a tragedy like a plane crash, a severe fire, or even skeletal remains discovered decades later in a forest. The environmental degradation, the heat, the trauma, it destroys the soft tissue, it destroys the DNA in the blood and the bone.
But the teeth are insulated.
Yes, the enamel acts as a thermal shield.
And even if the enamel shatters, the roots remain embedded deep in the jawbone.
Yes. So the forensic odontologist steps in and takes post-mortem x-rays of those surviving roots.
Yeah.
They analyze the 3-dimensional geometry of those root canals. They look at the unique, subtle curvatures of the pulp chamber.
Looking for matches.
Right. They look at the specific restorative materials, too. Maybe the exact slope of a filling at a messiobuccal line angle that we talked about earlier.
Wow, the coordinate system proves its worth all over again.
It really does. By comparing the clinical blueprint from the local dentist with the forensic map of the remains, they can make a positive match. The exact anatomy that allowed a person to chew their food pain-free is the same anatomy that allows a forensic team to identify a victim when all other biological evidence has just been erased.
It totally recontextualizes this entire textbook. It is not just a syllabus for passing a clinical board exam. It is a catalog of the most durable, resilient record of human existence we leave behind.
It really is.
The precision required to carve a wax tooth or to define a specific point angle isn't just about making a good crown. In a forensic setting, that precision is what holds up in a court of law. It is what provides closure to a grieving family.
The stakes of understanding this anatomy are incredibly high on both ends of the spectrum of life.
Let's pull all of this together. Our journey today took us from the foundational language of the mouth, the precise geographic map of thirds and angles. We explored the biological clock of tooth development and why understanding the timeline of a deciduous tooth can actually warn a physician of systemic disease.
We covered a lot of ground.
We challenged the necessity of tactile wax carving, discovering how it trains the hands to feel the biomechanical curvatures that protect our bone and gums. And finally, we saw how that very same internal root geometry acts as the ultimate biological black box in forensic science.
And as we always do, to fulfill the requirement for medical and educational reinforcement today, I have a short mental review exercise for you, the listener, to really solidify this material. We spent a lot of time discussing the rule that form follows function.
Let's put them to the test.
I want you to mentally visualize a specific tooth. Let's use the maxillary central incisor that's one of your top center front teeth. Picture its smooth facial surface facing your lips, its sharp, flat incisal edge for biting, and the subtle curves where it meets the adjacent tooth.
Okay, got it pictured.
Now, based on everything we discussed regarding proximal contacts and those protective embrasures, the gutters, how does the fundamental geometry of that incisor dictate the exact shape of the instrument you would need to use to clean beneath its gum line?
Oh, so you have to visualize the hidden root.
Yes, you do. Imagine the specific curve of a steel instrument required to perfectly hug the curvature of that tooth's CEJ without damaging the attachment. If you can visualize the negative space around the tooth, you truly understand the anatomy. Knowledge is most valuable when it is understood and practically applied.
That is a brilliant exercise. It forces you to move out of the textbook and into three-dimensional, tactile reality. And it perfectly sets up our final thought for today. As you go about the rest of your day, maybe you're sitting down for lunch or just talking with a colleague, take a moment to think about the incredible resilience of your dental anatomy.
It's something we completely take for granted.
Totally. The very structures you are using right this second to speak, to smile, to break down your food, these are the exact same structures that possess the biological durability to tell our physical history to anthropologists and forensic scientists centuries from now. You are carrying around the most durable letters of a novel that will long outlast you. Thank you for joining us today. Keep learning, keep questioning the why behind the what, and we will see you on the next deep dive.